Good afternoon. Can you hear me?
Yes, Doc. Good afternoon.
Okay, I'll start. Okay. So first of all, I'd like to welcome everybody to this pep talk. As a reminder to everybody, please mute yourself, but always show your video picture. Sign in your name, your Facebook account, or email address in the chat box. Please include names of companions attending. Use the chat box to ask questions and make comments while the pep talk is on. There'll be group pictures at the start and end of the pep talk. So please show your face in the video. Another reminder is after the pep talk, we will have a online learning cum evaluation test exercise or OLETE, which I have prepared. This will be used for mastery of learning, and please try to get the perfect score to get a certificate. I have placed the link in the chat box. Okay, this is a picture of the certificate that will be given to those who will pass the OLETE. Another reminder, 50 OLETE certificates will entitle one to one voucher for a free ROJoson telemedical consultation. I'd like to request also, please place your feedback in the chat box during the open forum and before we adjourn. So let's now have a group picture taking before we start the pep talk proper in 2 minutes. Okay. Okay. Ready? One, two. Okay. One, two. Okay. Get ready. Please show your face. Okay. 1, 2, 3. I have a patient empowerment program in which I like to empower the lay people or patients to take control in the management of their health. I started the pep talk on May 15, 2021. There are 3 courses in the pep talk. I completed the core course on October 9, 2021. And from October 23, 2021 onwards, I have been tackling health disorder and health issue courses. This may take 3 years or longer, depending on our enthusiasm and perseverance. My pep talk today is entitled Hand, Foot, and Mouth Disease. This topic was thought of because of the reported high incidence or increasing incidence of hand, foot, and mouth disease in the Philippines since October 2022, last year. So the empowerment objective for this particular pep talk is for the lay people to have a basic understanding of the hand, foot, and mouth disease, its diagnosis, treatment, and prevention. Background there for the incidence of the hand, foot, mouth disease. The hand, foot, mouth disease infection started in October 2022 in San Pascual, Batangas, where there were 105 cases detected, mostly among children aged 1 to 16. Take note of the age 1 to 16. In November 2022, around 550 HFMD cases were detected in Albay, affecting kids from 1 to 10. Again, take note of the age, 1 to 10 years old. In the same month, 145 cases were also recorded in the Ilocos region, mostly among kids aged 4 to 9, sa mga bata. The National Capital Region also logged 155 HFMD cases recorded from October to December 6 last year, most of them aged 11 and below. And a total of 93 suspect cases of HFMD were reported in the Cordillera region from January 1 to January 24 this year, 2023. So comparing to 2022 data, so this is a 1,450% increase. In 2022, there were only 6 cases reported in the Cordillera region. So then in Davao, last February 8, 232 suspected cases were reported. I cannot keep track of the latest. I think I don't know whether it has increased, but I think there's still HFMD going on. So with this frequent occurrence of HFMD in the Philippines, we should all be aware and beware of it. We should also know its high diagnosis, how to recognize it, how to treat it, and how to prevent it if possible. So this is part of our patient empowerment program. Before I continue further, I would like to clarify 2 terms, okay, which could be mistaken for each other. Hand, foot, mouth disease versus foot and mouth disease. The hand, foot, mouth disease, or HFMD, is a human disease. Sa tao lang, ha? It's a human disease caused by this virus, which is called Coxsackie virus. Whereas the foot and mouth disease is an animal disease, also called hoof and mouth disease. And this is also caused by a virus, but this time the virus is called picorna virus. So try to remember not to interchange the two. The foot and mouth disease is an animal disease, whereas the hand, foot, and mouth disease is a human disease. The contents of my talk will essentially be a case presentation and discussion of this particular disease, hand, foot, and mouth disease. Case presentation, as I said, this is a case I'm going to present a case that I encountered last February 10, 2023. So I had a telemedical consultation on a possible HFMD. So this occurred in a 42-year-old female breast cancer patient. Okay, so yung kanina yung sinabi ko, mostly young patients, no? But this one, this patient is a 42-year-old female breast cancer patient. So who called me up and said, "Hi doc, may I ask you if we can do a teleconsult? Nag-fever po kasi ako kanina pagkagising ko medyo masakit ulo ko at parang may plema. But I'm not sure," sabi niya, "kung dahil sa sipon or nahawa ako sa kids ko who have HFMD right now. Hoping na hindi naman at sipon lang. Naglalaro ang fever ko sa 37.8 to 31.1 degrees centigrade." So upon waking up this morning, she said that she felt a slight headache, but which disappeared after a few minutes. Then she had chills, mild chills, and then temperature taken was 38.1. So may fever siya. So up and about in fever, temperature was fluctuating from 37.5 to 37.6 at the time of the consult. So medyo nawawala na. So there was no frank sipon, no frank colds, cough, with mild pain and discomfort on the throat. Meron siyang discomfort sa throat. But she was able to notice some whitey spot and bootleg or blisters in the throat, in the mouth. So ito yung itsura. She sent me a picture. So mga bootleg sa langala, the palate on the roof of the mouth. Then another close-up picture of a bigger blister, okay, near the tonsil, no? Sa mouth pa rin. Okay. So she told me that her daughter, who is 10 years old, had been diagnosed to have HFMD MD on January 28. So that's about a 1 week before. And then a son, 7 years old, also had this HFMD on February 3, 2023. So the symptoms of these two children were fever, mouth sores, and skin rashes. But both are on the way to recover, okay, to recovery. No? So both have recovered from the disease. So she sent me the pictures of the rashes on the feet, okay, and then rashes on the hand and the feet. Okay, another picture of rashes on the elbow. Okay. So based on the pattern recognition for this particular disease is fever. So she had fever, mouth sores, meron siyang mga butlik-butlig, and then at that time of consultation, wala pang skin rashes, pero yung anak niya merong fever, may mouth sores, and then skin rashes. Okay? And at that time, yung pasyente mismo, 42 years old female, wala pang skin rashes, baka nag-i-evolve pa. No? Okay. Kasi she just felt, she consulted me just on the first day of the symptoms. Okay. So, but there's a history of exposure to HFMD in the children, and then there's a high prevalence now in the community. So the diagnosis that I have to make for the mother is that she has hand, foot, mouth, and disease, which I think was still evolving because there were no rashes yet. And so I will just have to wait for a few more days to see if the rashes will come out. If the rashes will come out, so 99% sure na tayo na hand, foot, and mouth disease. So for the children, of course, it has already been established the diagnosis will be hand, foot, and mouth diseases, but these are resolving already for the children. So I had an update afterwards. So sabi niya, so that's 3 days after the first day, the onset. Yes, Doc, ang dami na sa kamay ko. So the rashes have come out. So scalp initially. Second day, lumabas na yung sa right hand. So she has rashes on the right hand, then in the afternoon, sa left hand naman. So that night, sobrang painful ang mga paa at kamay ko. I can't even walk to the toilet. Parang arthritis ganon. Level ang sakit. Now, on my 4th day, nag-blister na din yung sa feet ko at sa hands, not sure kung drying up na ba. Masakit pa din ang feet and hands ko, but not as much on the 2nd and 3rd day. So yung sakit humihimpis na. So she showed me this picture. This is from the mother. So rashes on the hands, okay, and then also on the feet. So may mga blisters na rin coming out, okay. So with this development, so we're now quite sure. I'm now quite sure that she also nahawa na rin siya. So she has HFMD disease. So the treatment that I advise her to have will be a non-medication medical management, walang gamot, basta may ano lang for using rest, anxiety control, to tell her that it's something that will just go away in a few days para hindi siya matakot, no? And then high fluid intake, okay, kasi because of the throat pain, baka hindi siya uminom na tubig, baka ma-dehydrate. This is usually common in mga bata. Pag masakit ang throat, hindi na umiinom ng tubig. So we have to avoid dehydration. Then I ask her to eat foods that do not aggravate sore throat. Huwag yung mga pagkain na let's say maasim, masyadong maalat, maanghang, that will aggravate the sore throat. Then I advise her to just take paracetamol if the temperature has come back and reached 39 degrees. If not, no need for paracetamol for fever. But if there is intolerable pain, she can take paracetamol. Kung pain yung tolerable naman, pwedeng wala na. So non-medication medical management with monitoring. So I just ask her to follow up with me every now and then, usually after 1 week. So I'll now go to I have just presented the case. I will now discuss the hand, foot, and mouth disease. So hand, foot, and mouth disease was first reported in New Zealand in 1957. Coxsackie virus A16 was first identified next year in 1958 in Canada. So ito yung cause, itong virus. No? So hand, foot, and mouth disease has been considered to be a benign. Benign means it's not a cancer, it's something that will just go away, okay, by itself. That's why it's called a self-limiting disease. Okay? Even without medications, it will just go away as long as you just build up your resistance. But HFMD is a contagious or infectious disease. It is a very contagious and infectious disease. The term HFMD derived its name from the typical presentation. You have rashes, lesions, maculopapular vesicular lesion involving the skin of the hands, feet, and oral mucosa or the throat or the mouth. Okay? So this is the origin of this name. So hand, foot, and mouth disease gets its name from the blister-like, usually parang blister ang itsura ng rashes that forms on the hand, feet, and mouth. The rash can actually appear anywhere in the body. Pero ito pinaka-common area, kaya tinawag na hand, foot, and mouth. No? Pero the picture that I showed you on the boy, there were also rashes on the elbow. So pwede pa rin mangyari na mag-appear siya sa ibang lugar aside from the hand, foot, and mouth. So it can occur in the trunk, extremities, genitals, buttocks, or anywhere. Pwede. So how to diagnose the hand, foot, and mouth disease using pattern recognition? Essentially, itong tatlo lang. Okay, fever or flu-like symptoms, and then kung may associated mouth sores, mga blisters, okay, and then skin rashes. Once you have this, you start thinking of hand, foot, and mouth disease. Okay. So the DOH's diagnostic classification of hand, foot, mouth disease. Okay. So just like in the COVID-19, you have the so-called suspected, probable, and confirmed cases. They use the same classification. Okay. Suspected cases means any individual, regardless of age. In this particular case report, you saw that although it's very common among children, adult can also be affected. Nahawa lang. Okay? Okay. So regardless of age, pwede ding matanda. Pero majority were occurring in the mga bata, no? Who develop acute febrile illness, fever muna, with papullovesicular or maculovesicular lesion. So tandaan na lang yung parang rashes, parang may blisters ito. These are technical terms. Okay? On the palms and soles, as I said, pwedeng sa ibang lugar, pero pag meron dito sa typical areas, you suspect already a hand, foot, and mouth disease. Okay? So regardless of age, and then may fever, may rashes on the extremity, and the hand and the foot, and also on the mouth. Okay? So suspect na ito. Then you call a patient as a probable case if the suspected case has not yet been confirmed by laboratory. Kung may laboratory test na to check the virus, it's now called a confirmed cases. Okay, just like sa COVID, meron tayong suspected case kung wala pang test. Okay, probable. Okay, probable because we are in the COVID pandemic era. Kaya naging probable, pero wala pang test, no? Okay, so if you have a hand, foot, and mouth disease or patients presenting with fever, sores on the hand, foot, and mouth, and then in the community, marami na noon, no, geographically, okay, let's say in that particular area or in a particular house, okay, at the same time, wag naman yung let's say 1 year and 1 year ago at last year may kaso. So ito sabay-sabay nila. When I say temporal, sabay-sabay sila during this week, during this month, no? Okay. So maraming laboratory confirmed cases. Okay. So yung mga let's say Cordillera, Davao, yung mga maraming kaso, kumpul-kumpulan, no? And then suddenly a person develop the same symptoms, we call that number one probable case already. No? Okay. So confirmed case will be those with positive laboratory results already for human enterovirus that cause the FMAD. So may laboratory test, parang yung sa atin, antigen test sa COVID-19 and also the RT-PCR. Kung may test na talaga confirm na yun. So how to diagnose hand, foot, and mouth disease? So during the outbreak, medyo madali, no? Okay. One can usually tell if someone has hand, foot, mouth disease by examining the patient and the rash appearance while considering the patient age and symptoms. Usually sa bata, kaya you consider the patient age. Okay. Sometimes the doctors, the healthcare providers might collect samples from the patient's throat or feces. So you can collect the throat, parang swab, and then the feces, kasi doon din dumadaan yung mga virus, and then sent to the laboratory to test for the virus, which is the Coxsackie virus. However, usually these tests are not being done, are rarely done because usually nare-recognize na, but if you really want to have it documented, no, and then if the diagnosis is uncertain, baka it's hard to differentiate from other diseases that present with hand, foot, and mouth presenting symptoms, then you have to do a test. So hindi naman lahat na yung nagpresent ng fever, sores on the hand, foot, and mouth are really the so-called hand, foot, and mouth disease. Merong mga ibang diseases that will present with the same picture. Okay, so example, this is a list, no? Parang herpes zoster can also present as a ganong itsura, herpes simplex, ganun din, no? Okay. And then monkeypox, no, can also present as the same presentation as hand, foot, and mouth disease. Okay. So if an outbreak is not present, kung may outbreak, medyo madali, no? So sabi natin, most likely yun na yun, no? Kasi may outbreak na, no? Maraming taong meron, no? But if an outbreak is not present, it may be difficult to diagnose. So that's the time you may have to do the test. Okay. If you want to document it and if you think the management will differ, let's say kung different ang management ng viral pharyngitis versus hand, foot, and mouth disease, ibang kaiba, then you do the test. But usually pare-pareho lang yung gamutan dito. Okay? Pare-pareho lang, no? So sometimes you can distinguish the different types of diseases that present with hand, foot, and mouth symptoms by looking at the itsura ng blister sores, no? So example dito, yung herpangina, usually white, may blister-like. Ito, dito sa hand, foot, and mouth, usually mapupula. Okay, red, no? Okay. So usually in this particular patient, in this particular disease, herpangina, usually kung minsan may skin rash, pero bihira may skin rash. Okay? Sa monkeypox naman, example sa monkeypox, they also present with rash and with blisters on the hand, face, hand, and feet, body, eyes, mouth, and genitals. Okay, so basically, ganun din sa hand, foot, and mouth disease, meron din rashes, may blisters, then you also have fever, then swollen lymph nodes, okay, headache, muscle backache, and low energy. So, mas matindi yung symptoms usually ng monkeypox. So, if you have this, you start considering monkeypox, especially if there's an endemic going on, kung bihira, kung kokonti pa lang kaso ng hand, foot, and mouth disease. So, usually, just like the monkeypox and also the hand, foot, and mouth disease, usually the mode of transmission is skin-to-skin contact, kasama sa bahay, face-to-face contact, and then mouth-to-skin contact, and then touching contaminated bedding, towels, and clothing or objects. So it reminds us of sa COVID-19, di ba? Ganun din ang mode of transmission. Okay. So yung protection is basically the same for monkeypox and hand, foot, and mouth disease and COVID-19 and other disease like infectious diseases of the appearing with practically the same symptoms. So you isolate at home in a well-ventilated room and then talk to health workers if you have symptoms. Avoid skin-to-skin or face-to-face contact. including sexual contact if you and the other person have symptoms, clean hands, objects and surfaces that have been touched regularly, wear a mask and disposable gloves if you are in close contact with someone with symptoms. So the usual age of affectation, usually more common sa bata. Nag-umpisa usually sa bata, common in infants and children. But as mentioned and as illustrated in this particular case presentation, adult can also be affected. Okay, hindi immune yung adult. But usually adults have milder symptoms than children. Usually adults meron ng mga exposure to the disease, baka meron na silang antibodies to combat it. Okay, so most children usually have mild symptoms lang. That's why we call it's a benign disease and self-limiting. Yeah, usually mild lang. They usually last from 7 to 10 days. It can be 14 days depending on the situation. Treatment, there's no specific medical treatment for hand, foot, and mouth disease. Okay, treat the symptoms, kung ano mga nararamdaman niya, ano mga discomforting symptoms. Okay, then prevent dehydration. As I said, yung sore throat, baka yan ang papadehydrate sa pasyente. So you have to you have to ask the patient, to encourage the patient to keep on drinking water. So then you can, if there are symptoms that are not tolerable, you can take over-the-counter medications to relieve fever. Kung mataas lang, kung 39, kung less than 39, you don't have to take paracetamol, and pain caused by the mouth sores. Don't give aspirin to children. Okay, drink enough fluids. Mouth sores can make it difficult or painful for the patient to swallow. So your child may not want to drink much, kaya baka ma-dehydrate. So you try to make sure that they drink enough to stay hydrated. No antibiotics. This is a virus. Kaya this, just like in COVID-19, we don't give antibiotics. Okay, kasi virus yan eh. No need for antiviral drugs. Hindi naman kailangan. Kasi self-limiting yan. Okay. Then no vaccine developed yet. Wala pang vaccine for this particular disease. Prognosis, most people with hand, foot, and mouth disease get better on their own in 7 to 10 days. That's why it's called a self-limiting. Kusang mawawala. Self-limiting disease. Okay. A question being asked, can you get hand, foot, and mouth disease twice, 3 times, to 4 times? Pwede. It is possible to contract the virus more than once, but the symptoms usually are less severe because may konting antibodies ka na, pero kulang pa yung antibodies mo, kaya kakasakit ka pa rin ng hand, foot, and mouth disease. Is it airborne? Ito palagi, just like in the COVID-19, tinatanong airborne ba siya o hindi? Okay, so it's moderately infectious. It's not a deadly infectious disease. It's spread by direct contact muna with nose and throat discharges and fluid from the blister, yung mga tubig na nanggagaling sa mga rashes na may blister, and then feces also are infected. You can get it from the feces of infected individual. Airborne droplets can also be the cause of the spread of the virus through the sneezing of and the coughing of the patient. Kasi nasa bibig yan eh. Kaya baka pag umubo at nag-sneeze yung pasyente, yung virus will just go to the other person, to other persons. Should parents quarantine if child has HFMD? And why do you need to quarantine? As mentioned, it's very contagious, just like COVID-19, very infectious. To help prevent the spread of HFMD, it's important to stay at home from school or work while you and your child have symptoms. You don't have to be confined if it's that's complicated. Just stay at home. Okay. What is the contagious period for the hand, foot, and mouth? The time that it is very contagious is during the first week that they are sick, usually first week. And sometimes it's spread from people can sometimes spread the virus to others for days or weeks. These are exceptions. No? After symptoms have gone away and they have no symptoms at all. Okay. But usually we are guided by this one when we manage the patient. Yung first week is the most contagious, no? Kaya stay home muna, baka parang di tayo makahawa ng ibang tao. What is the final stage of hand, foot, and mouth? When you say final stage, yung pawala na. Okay, the final stage is yung mga blisters, yung mga red spots, no? Okay, nagda-dry up na sila. Okay, pag nagda-dry up na sila, medyo tapos na yon, no? So how do you help prevent catching or spreading hand, foot, and mouth disease? Wash your hands. Wash your hands often with soap and water for at least 20 seconds. Help your children wash their hands. Teach them how to wash their hands and make sure they wash them often. Number 2, clean and disinfect the surrounding areas, yung mga frequently touched surfaces and shared items, including toys and doorknobs. Okay. So we're familiar with this because of our COVID-19 experience. And then avoid touching your eyes, nose, and mouth. You can get infected with hand, foot, and mouth disease if you have the virus on your hands and then you touch your eyes, nose, or mouth. To lessen your chance of getting sick, don't touch your eyes, nose, and mouth with unwashed hands. And then avoid close contact with sick people. Avoid touching someone who has hand, foot, and mouth disease, but such as hugging or kissing. Again, it reminds us of COVID-19 yung mga precaution. So if your child is sick, okay, as I said, normally, yung HFMD, usually mild, so just rest for 1 week, 2 weeks until the child is feeling well, and then there are no blisters anymore, nag-dry up na, so they can go back to school. Okay. As mentioned here, as long as they have no fever, no uncontrolled drooling with mouth sores, they feel well enough to participate in classroom activities. Okay, so pwede na pumasok. Okay. So, summary and takeaway for this particular pep talk. Again, I want to emphasize, do not interchange hand, foot, and mouth disease with foot and mouth disease. In foot and mouth disease, yung mga yung mga sakit ng animals, no? Okay, whereas the hand, foot, and mouth is the sickness of human being. So these are the pattern recognition symptoms. So may fever, may flu-like symptoms, may mouth sores, skin rash, you start thinking of hand, foot, and mouth disease. And then the usual age, usually bata, but adult can be infected. Okay, usually so adult, usually milder in symptoms, and children usually recovered after 7 to 10 days. The treatment, no specific treatment. Magre-recover lang sila, it's self-limiting. So you don't need medications, yung mga gamot-gamot. You just rest and have an anxiety control, mean telling them that it's nothing to worry, no? Then high fluid intake, eat foods that do not aggravate the sore throat, take paracetamol only if the temperature is 39, and if there is intolerable pain, wherever it is, usually sa throat ang masakit, in the throat and also in the mga rashes in the skin, kumisan sa hand and foot, kumisan masakit. No antibiotics, no antiviral drugs, no vaccine yet at the moment. Okay. Prognosis, most of them will recover within 7 to 10 days. So takeaway in relation to patient empowerment, be always in touch with reliable medical information on hand and foot and mouth disease. Knowledge is power. It gives power. Use the 4 Ks of patient empowerment: kaalaman, kakayanan, karapatan, and kapangyarihan to gain greater control over decisions in preventing, recognition, and treatment of hand, foot, and mouth disease. So with that, I end my pep talk. Okay. Hand, foot, and mouth disease, a case presentation and discussion. I hope I have empowered you to have a basic understanding of hand, foot, and mouth disease, its diagnosis, treatment, and prevention. So before we go to the open forum, again, reminder, please take the OLETE and have a try to get the perfect score. If you do not have a perfect score at the first try it again until you get the perfect score. And then 50 OLETE certificates will entitle 1 participant to a free voucher for a ROJoson telemedical consultations. Then, again, another request, please place your feedback in the chat box during the open forum and before we adjourn. Let's now have a group picture taking before we start the open forum. Okay. It's one, ready? 1, 2, 3. Okay. Okay, the floor is now open for questions, comments, sharing of experience, anything, consultations. Pwede rin. Okay. Anybody? Who has experience with hand, foot, and mouth disease? Wala?
Wala. Me
Wala
not.
pa. Okay.
Hope not.
Of course not. The others, wala. Good. Are we
I just saw on
Huh?
TV.
Pardon? Go ahead.
We just saw it on TV.
TV.
Oo.
Marami. Are you watching the TV? Marami pang kaso?
No, none na. Matagal na yun.
Okay. Pero itong February meron pa eh. Marami pa. No. Okay.
TV is erratic eh. I don't hardly watch. Once in a while lang. Chamba.
Chamba ang ano? Watching the TV or ano?
Yeah, watching the TV, catching mga news like that.
Okay. Okay. So sinong may experience? Wala. Minsan natatakot tayo. Baka sometimes sabi ko importante yung you follow the trending of the disease. Yung COVID-19 kung still mataas, we have to consider COVID, pero pababa na, kaya we consider another disease. No? Okay. So the diagnosis is influenced by the high prevalence of the disease. No? In a particular time and in a particular community. No? Okay. So kung isang community very rare ang hand, foot, and mouth disease, you don't suspect hand, foot, and mouth disease. But in another community, kung mataas, then you suspect that. No? Okay. Okay. So, Chris Nisesha is raising her hand. Chris?
Hello. Hi, Doc. Good afternoon. Good afternoon, everyone.
Hi, good afternoon.
Good
Doc,
afternoon.
question. Actually, may question ako. To make it official, ano nagiging yung source ng sakit po na to? Yun bang sa food? Ito ba yun? Or ano?
Saan?
Saan? Sa food ba? Sa food intakes?
Yung pinakasimula, saan?
Kasi ano siya, di ba ngayon hawa-hawa na. Pero ano talaga yung yung source ng sakit po na ito para maiwasan din po namin. Thank you.
Okay. Yung let's say kung 0 muna, walang kaso, biglang nagkaroon, no? Yan ang tanong mo. Tama?
Opo, Doc. Tama po.
Okay. Kasi kung may kaso na, alam natin, hawa-hawa na yon, di ba?
Yes po, Doc. Hawa na siya eh.
Kasi yung mga sakit, parang yung mga virus, bigla na lang lumilitaw eh. No? Just like in COVID, bigla na lang lumilitaw because of, hindi lang natin matrace kung bakit. Basta lumilitaw lang, di ba? Okay. So,
akala ko, Doc, galing siya sa sa mga pork, mga ganon,
Saan?
sorry. Sa
Galing
mga
saan?
pork, mga baboy na binibili natin sa palengke na gano'n. Akala ko gano'n, sorry. Meat pala yun.
Kung, ay, you're not talking about foot and mouth disease, yung mga pork, yung mga baboy.
Opo, opo, parang gano'n.
Okay.
Akala ko galing din siya sa mga gano'n, Doc.
Just leave it, sabihin na lang natin, yung mga sakit ng mga tao, especially yung mga viruses, they just prop up, no? Okay. Because of the environment, but we cannot identify. Just like yung cancer, di ba? We talked about cancer before. Hindi natin ma-really identify yung ang daming factors, no? Ang daming factors that will contribute to the development of a cancer. Ganun din, maraming factors that can develop to a certain virus coming out, no? No, we cannot, it's really difficult to identify the exact cause, yung specific cause ang hinahanap natin, di ba? As much as possible, gusto natin malaman, di ba? Kung alam lang natin, baka pwede makontrol natin. Pero year in, year out, bumabalik yan di ba? Okay. So once a person has it, yun na, tuloy-tuloy, kakalat na yan until baka ma-develop yung antibodies. Just like in COVID, di ba? COVID, biglang na lang lumabas, no? Karoon ng, kasi first decision, kaya maraming namamatay kasi wala pang antibodies sa mga katawan natin. Ngayon, meron ng antibodies sa mga katawan natin because of exposure to the COVID-19 and also to the vaccination. Ngayon, pawala, no? Pero yung COVID-19, hindi pa totally mawawala. Okay? So, maglalaylo lang siya. No? So, it will be just like a flu. So probably every now and then you can have isolated cases of COVID-19 pa rin. No? Hindi siya totally mawawala. No? Okay. So, unlike yung mga smallpox for a while, nawala na no? Because of the vaccination. Pero ngayon, bumabalik din. No? Okay. So just accept the reality that we can never know the exact cause of all the diseases. Just be ready to accept it, but try your best to know how to recognize and how to avoid and how to prevent its progression. So yan na lang Okay. Okay? Grace?
Thank you po, Doc. Thank you.
So, Marites, Onglin, can you share? Kumusta na yung anak mo? My kids and sisters had. Wow. Kaya hindi. Okay. Wala na si Marites. Nag-sign out na yata, no? So Marites Ong Lim said that my kids and sisters had. So yung kids niya, I suppose, 7 years old, no? Nagkaroon. Okay. And then, yung sisters niya, knowing her sisters, medyo may edad na. Okay, so tinamaan din, no? Okay. So just like in this particular patient na pinesent ko, meron siyang 2 anak, and then siya, 43 years old, tinamaan din siya, no? Nahawa siya, no? So it's an illustration, the adult can be infected also. So Maria Hustapolotan, we had several cases in our school some years back. Okay, so it's there, no? Paulit-ulit lang siya, no? Okay. So ngayon, wala na. Wala mo.
Matagal na hong wala. I mean, kasi ho, it's very then we just hear that okay, another school merong mild outbreak. So then we're extra careful. So we always disinfect every morning, every afternoon. We disinfect everything that is in the classroom. Gano'n na lang po. And then we make it a point that when the children come, we look at them. We check their hands. Of course, we cannot check mouths, no, but we try and check their hands and their hair under the guise,
Yeah.
Kasi
Yeah.
we also sometimes, if we hear that there's an outbreak in another school, we send communications to the parents already to be extra careful also that
Yeah.
it's
Okay.
starting again. Gano'n na lang, just to prevent a huge outbreak of the disease.
Yeah.
Kasi
So best effort na lang, no? Best
hindi kasi children will, yeah, especially our children, they're preschoolers, so they will really cough and sneeze and
Yeah.
touch.
Mm-hmm. Yeah.
You know, not
Yeah.
we them wash their hands frequently.
So,
That's it.
in your experience dati, anong months ang prevalent nun?
Wala akong months talaga. They just come.
Yeah.
No, there's specific time.
Wala no? Wala no? Yeah.
Talagang hygiene na lang ho to try and prevent
Yeah.
hygiene.
Yeah, hygiene na nga. Okay. So, healthy lifestyle. Also to healthy lifestyle for the children, also for the adults, no? Healthy lifestyle in terms of hygiene, in terms of building up resistance, no? Ganun na lang, no? Okay. So yeah, sabi ko kay Chris kanina na yung mga sakit ng tao, sad to say they just come that we cannot really avoid them, no? Mahirap i-avoid, no? Try your best na lang, no? Okay. Okay. So thank you for sharing, Maria Justa. So there's a comment or question by Rene. Food and mouth disease also contagious disease that can be acquired from animals that are expected with teeth. Yeah, yan ang katumbas, no? So human being yung hand, foot and mouth, and then yung food and mouth disease sa mga animals, no? Okay. Kaya yung mga sa airport, di ba, palagi meron mga mat na parang nagdi-disinfect, no? Try to avoid the mga foot and mouth disease also, no? So any other comments, questions? So wala nang people who experience that, and you know how to recognize na. Let me just have a show of hands. How many people have heard the foot and mouth disease before or the first time? Lately? Ano yan? Before. Okay. Yung first time lang, how many heard the hand, foot, and mouth disease for the first time? Akala nyo, baka pareho lang yung, kasi very well known yung mga sa newspaper palagi yung foot and mouth disease, no? Mga animals, di ba? Yung mga kuna-quarantine ng mga Bureau of what? Agriculture? Ano ba yung mga in charge of Bureau of Immigration ba? Bureau of Immigration sa tao, no? Pero yung mga in charge of the animal safety, agriculture, di ba? Okay, so they will try to ban yung mga animals that are infected with foot and mouth disease, no? Okay. So I hope all of us are more aware now of what a hand, foot, and mouth disease now. So I just presented this just for a simple reminder lang, awareness, no? Okay. So any questions, any comments? Any more questions and comments? Nana?
None.
None? Okay. So if there is none, it's 5-3, 4-3. We can end this pep talk, short pep talk. Okay na?
Yes, Doc.
Okay. So next week we will have a little late kasi February, matatapos February, but February we are celebrating yung awareness on the rare diseases of human being, sa atin everywhere, not only in the Philippines but also in the world, no? So I'll be talking about rare, common, uncommon, and common diseases, no? For awareness lang, simple talk lang, no? Okay? So if there are no more questions, let's call it a day. So we'll see each other next week. Okay. So thank you for attending. May bago tayong attendee, Rene Tubaklas. Okay. And so welcome back, Francis Tejones.
Thank you, Doc. Thank you, Doc.
We've-
Nabisi
Okay lang, okay lang. Okay lang.
ko po.
Okay. Okay, may pahabol si Rene. Can, if FND can be transferred to human to, as far as I know, hindi. Iba yung ano niya eh. Iba yung mode of transmission niya from animal to animal. Pero there are reported cases, pwede, no? Just like yung mga reported po, di ba, yung COVID-19 sinabi from monkey to human being, no? So may mga isolated cases. Anything is possible, no? Pero usually hindi, no? Okay. Okay, I hope I have answered your questions. Okay, Rene? Can I see your face, Rene? Yan. Okay, have I answered your question, Rene? Okay. Bihirang-bihira, ha? Pero pwedeng mangyari, theoretically. Okay? So, okay, if there are no more questions, let's call it a day. We'll see each other next week again. Okay.
Thank you po.
Thank
sige.
you.
Thank you. Thank you, everyone. Thank you, Doc.
Edna, okay, Edna, I'll answer you later on. Through,
Sige. Okay.
okay, bye-bye.
Thank you.
Bye-bye.
Bye-bye.
Thank you,
Bye,
Doc.
everyone.
Bye-bye.
Bye-bye.
Ba.
Thank you po. Bye-bye.
Thank you.